So today we are going to talk about lacunar ligament and pectineal ligament. These two ligaments are very important in the region of groin, and especially when we are doing surgery in groin region for hernias or pelvic fractures, or even in some gynecological operations, right? And once we have discussed their locations, then we'll talk about the differences in them and the clinical importance, and after that I will talk about corona mortis. Corona mortis is arterial anastomosis near these ligaments, that if inadvertently surgeon damages this anastomotic connection, which might be made by the accessory obturator artery or aberrant obturator artery, that is a matter of life and death. Retropubic area, they will retract into pelvis, and bleeding will be retroperitoneal hemorrhage, retroperitoneal bleeding within the pelvis, and it is very difficult then to catch the end of these vessels, and then it becomes a matter of life and death. More accurately, we call it
Lateral expansion.
lateral expansion. This femoral ring is here and femoral canal is here. Actually, it's a weak point. Under pressure, they can push into this canal, and that is called femoral hernia. One important lymph node, which is called lymph node of Cloquet or Rosenbuller, right? Now, this point, this opening is opening into abdominal cavity. And from there, if something enters here and goes down, what is it? What is happening here? Herniation. Herniation. Which herniation? Femoral herniation, because herniation through the femoral canal. It is going to the upper part of the thigh, right? So all these things contribute to higher prevalence of femoral hernia in female than prevalence of femoral hernia in male. We are comparing femoral hernia in female with femoral hernia in males, right? Surgeons hate lacunar ligament. One reason, it is causing strangulation. Second reason, when you go to release the strangulation by putting a nick here, and unfortunately if variant artery is sitting there, right, you cut that and fatal hemorrhage occurs. There was corona mortis. Corona mortis has not studied the textbook, so it can be here or it can be here. So that tragedy can also come occur. But they love it too, because if they are careful about corona mortis, right, and they separate it and ligate it properly and then proceed with the surgery, pectineal ligament provides the strongest anchor space to the surgeon, where during hernial repairs he can put the sutures or he can put the staples to anchor the mesh. We'll discuss into detail about normal obturator artery, especially in reference to accessory obturator artery, aberrant obturator artery, and difference between accessory and aberrant obturator artery, and how they make the corona mortis, and what are the different causes where corona mortis can be proved fatal, not only hernial surgery, maybe pelvic fractures, which involve the superior ramus.